She loved her snacks.
Bunch of snacks, baby. That was it.
She, look at it. Look.
What have you here? I don't know if some of you fans remember, this is Baby. Baby's been here before. She's a very sweet girl. She's also an older horse. Her owners adopted her out hoping that she would gain some weight because she was skinny when she was adopted out, and she was just heartbroken that she's not gained any. So we're gonna pull some blood. Nicole's already got the blood from her, and run that and see if there's anything we can do to help Baby. She's sound though. She's gonna be happy for the weekend, and we're excited to look deeper into them next week.
You show everybody out there how good you are, how good of a boy you are. Yeah? You like that? Is that a good spot? Okay. I found a good spot, huh? All right, sit back down. I'm not done.
Hallie, so what's going on this morning?
So this morning we're having a lot of small animal surgeries. So we did a lot of cat surgeries this morning, and then now we're prepping Jax for his surgery. He's one of our husky mixes here at Horse Plus. So yeah, we're just doing a lot of small animal surgeries and getting them ready for adoption.
I've got small animal things up here. Let's see if that works. And I'm sorry I didn't move the table down. Still. It's our only dog patient today, otherwise we just had cats.
Awesome.
The first dog I spayed on an externship was a husky that belonged to a technician. And she woke up and screamed and screamed and screamed, and I was like, what's happening? And the vet was like, oh, it's fine. It's just a normal husky thing. And I was like, this is horrible. I'm not sure what that little blob is right there. Let's not cut it. So when I neuter dogs, I do a pre-scrotal approach. It feels like every couple of years they flip-flop what they teach vet students to do. So this is just how I learned how to neuter dogs. But for a while, a scrotal approach was really popular. I don't know. You would think that there would only be like one right way to do surgery, but there's not. There's a lot of opinions. So step one is having a thorough physical exam. That has to happen. In a shelter setting, we usually have 0 medical record history. So we have to do a really, really thorough physical exam and make sure that the pet is a good anesthetic candidate. We have the capability to do in-house blood work here. So if a dog is over 6 or has any other abnormality on physical exam, and I'm not sure if they're gonna be a good surgical candidate, they all get treated for fleas and ticks and dewormed. And then immediately before surgery, if they've just had an exam like one day before, then we don't really have to repeat stuff, including weights, although sometimes we have little teeny tiny kittens, and then I'll reweigh them. Once we have their weight and we've determined that they're a good candidate for anesthesia, they undergo anesthesia with us, and then Nicole or Hallie or whoever is assisting in surgery will usually prep them. So today we had 5, 6, 9 other surgeries. I don't remember. They kind of run together after a while. And so often my assistant is helping prep the next patient and helping recover the previous patient while I'm actually in surgery. So I have to make sure that I'm available if they need me, but I don't necessarily have to be the person who's directly doing the recovery. I'm closing 3 layers. The deeper hole where I pulled both of these testicles out, and then we're gonna close subcuticular or subcutaneous and then skin. So usually in a spay, for example, the deepest layer is kind of the most important holding layer. And that way, if we have an owner panicky, my dog chewed my stitches out, usually it's just the skin sutures that they get out, and we can close it again before anything really bad happens. We just finished up a busy morning of small animal surgeries. We neutered this cute little husky, and he's slated to go to an adoption event later this week. And we're gonna switch gears and look at horses next. Boomer is one of our general population horses. He's a thoroughbred. He was an owner surrender. He's a pasture pet, and it looks like he punctured his shoulder. So I haven't actually seen the wound yet, but he is our next patient of the day.
We aren't in a hurry. All right, I'm gonna get some Coggins photos. Big boy. Hey, dude.
That's feet there, Deb.
He's a Tennessee Walker, ain't he? You're so pretty. All right, he's good to go. You want your lead rope back?
That's yours.
Okay. Hello, pretty girl. Are you mom? Yeah, she is. Oh, they're so pretty. Post videos and photos of them, and then they'll be online, and people will come and they'll find a new home.
Well, I get out of your hair then.
So we just had 2 surrenders this morning, and they're horses, which is my favorite. I love surrenders. They look rather healthy, and unfortunately I didn't get to speak with their owner as much, but Anna, our front office receptionist, did, and she's a wonderful lady, and she trusted us with them, and we want to thank her for that. Tennessee walking horses, and they're beautiful, so that's what Tennessee walking horses are supposed to look like, that are taken care of. But yeah, we had our surrenders this morning. We've been trailering horses up and down, getting them cleared and all that stuff, and it's not even 10:30 yet.
Okay. Well, this trip is, I have to sleep between now and this trip, so just to make sure I don't forget it at Horse Plus and we get to the res without this thing, this is going in my car right now. Oh yeah.
Now, will it fit is the question.
Oh gosh, yeah, true. We might need like a trailer to, oh gosh, look how, thing is huge suitcase. Okay, I don't know, okay. It fit. We don't have a whole lot of room left, but it's in. So we're gonna roll with that.
The Wild Horse Res event is very exciting. It's coming right up here, and we are trying to see if we can get all of this into the suitcase. Justin's a master packer. We can take them out of the boxes.
Well, it's not gonna be
Chris, I'm gonna pass this over to you.
Oh yeah?
Justin's
It's gonna be over 50 pounds.
What are we doing?
Sure.
Is that over 50 pounds itself?
Oh my gosh,
This is
how
probably
in the
like-
world are we gonna get that in
This is
there?
probably like 40.
I have
All right.
we might
Oh man.
That's not happening. It's already compressed as hard as it'll get.
That is that might be,
That's not gonna work.
oh, I can sit on it. Here we go. Oh.
Oh, yeah.
Oh yeah. Oh, okay. Oh. There we go. Okay, so for the purpose of this video,
Yes,
no
40
inflatable
46
horses, no inflatable
46
horses were
pounds.
harmed in the making of this video.
All right.
Oh, we're barely over. 53. Okay.
.7 pounds.
47?
Yeah.
Oh, look at that.
47, so we can put.
Oh. Oh no. That almost hit me in the face. That was almost a very close call. Okay. Can we do it?
Has to calibrate.
You can do it. Okay.
50.
50.4. Oh. I mean, all you have to do is while the thing's on the little weigher, you just put your foot on it a little bit.
Yeah, push up on the scale.
Yeah.
Not over 50, they're typically fine. And I think you guys got this.
Oh gosh.
Scenario, you have to put one of those horses in your backpacks.
Oh gosh. You heard it. What does that mean? Oh, there we go. You can do it.
There we go. 50.
49.8.
All right.
Oh yeah.
All right, this will be Chris's one of his suitcases.
Oh gosh. What do you think? You think I got it?
You got it.
We can do it. Okay. Just come with us.
Wow, 6:02. Would that be possible?
That's a good one.
It's a good one. Done. Done. That's exactly what it sounds like.
Oh, that's terrible.
Well, let's learn more. She's got hyperperistalsis too. This sweet little mare's name is Baby. She was at Horse Plus last fall, so almost a full year ago. She came in as a transfer from another rescue organization, and Dr. Gina and I looked at her. She did have some dental pathology when we saw her last time, and she was thin then, although she wasn't this thin. She's about 21 years old, but she got adopted locally, and she just lost weight. So hooray for responsible adopters. The woman who adopted her tried a bunch of things, wasn't able to get her to gain weight, and brought her back to us, which is exactly what we want to have happen. You're a good girl. We're going to do some in-house blood work. We're going to repeat radiographs of her teeth to see if there are any changes from last year and if she needs anything done. One unfortunate change from when we saw her last year is that she does have a heart murmur today. And according to her physical exam form from last year, she did not. Heart murmurs can develop. They can be made worse by dehydration. She does have some hyperperistalsis. So when I listen to her, you need the cookies. When I listen to her gastrointestinal sounds, her guts are gurgling really quickly. So sometimes horses can't absorb what they need to if food moves through too quickly. So that's can be a really difficult problem, but sometimes if it's diarrhea, it can be an easy fix. So we're just gonna take a really close look at her today and get some diagnostics and kind of go from there. You're a good girl. For the record, that kitten has everything she needs. Everything.
Besides a family.
Besides a, please.
She says, thanks.
Excuse me. Good girl. Okay, that got caudal.
Oh, I forgot to. Oh,
Drop down. Yeah, ready? Okay. If we can. They don't look great. They don't look necessarily worse than when we saw her last year. She's got a little tiny hook on the back right here, but like that one's smoothed off. I don't know that I can do a whole lot to these teeth.
Yeah.
Right? Like I could reduce that one a tiny bit.
If you go back an image. Like these ones.
Yeah.
Are like bloop, bloop, bloop.
Yeah. Let's run some blood work. Hey, you be a good girl. Good job. Look at that, Sydney rocking it. We didn't find the news that we wanted on Baby today. She has a pretty severe heart murmur. It sounds like a big squeak. Heart murmurs are graded on a scale from 1 to 6. I graded hers at a 5 out of 6. You can hear it very loudly on both the left and right side. And this is a new finding for this horse. When we saw her last year, no heart murmur was documented or heard. So her teeth are not great. I don't think her teeth are the primary problem. So in this mare's case, I was kind of hoping that we would find that she was dehydrated, but she was not dehydrated. She's very well hydrated. She doesn't have an infection anywhere. She has an appropriate number of red and white cells. She's not anemic. So this leaves us with a mare that has a reported history of being very well fed, who's been rapidly losing weight. She also has some increased gut sounds, so food is moving through more quickly than it should. We have a very severe cardiac problem. Unfortunately, I don't think I can fix her teeth, and I definitely don't think that I can improve the severity of that heart murmur. So I think that's probably the answer. I'm really thankful for the adopter bringing her back. I think we're gonna have to make a hard call and let Baby go, but really, this is a win for me. This mare did not get dumped into the slaughter pipeline. She didn't have to stand in a field and starve to death. She got lots of love and attention. She got people advocating for her, and she's gonna get to pass with comfort and dignity. So that's what we're here for.
So today we're out here and we are training horses on how to use the automatic water post. There are new watering systems that have been put in, and we're so thankful for Jason and our outside help and Keith that they put these in. They're supposed to be sanitary. To be honest, I don't know a whole lot about them. I just know that I need to train these horses to find the post. So that's what we're gonna do today. These are our horses from our July buyout, I believe. It's hard to keep track when you have a lot in quarantine, and hopefully they're about to get rechecked and fingers crossed cleared. They're super sweet. But anyways, we'll see if they're interested in the watering post. Come on, let's go see the water. Let's go. If you look right here, so you're gonna press down. Look at that. Hey, you.
Oh, there you go.
Press down.
Here.
Yay. Press down. All right, so you're all out. You gotta press.
He's like, no, I want you to do it. I'm guessing this will take some time for them.
And if the horses seem thirsty or if they seem like they're just not learning the automatic water system, we always put a trough out. Like, we don't make anyone drink out of these, but if they want to, because it's cold and fresh water every press, we like for them to have that option.
Oh. You got it.
Go, buddy.
Come on. All you gotta do is push.
You're doing the baby. Good baby.
Well,
Are you yawning?
what was the verdict?
I think it's gonna take them more than what we thought, but we have some smart horses. They'll remember that that's there and it's weird and it's new, and they'll come and mess with it, and then they'll realize the water will come out of it. So I think it'll take them about 3 or 4 days since I've showed it to them. But it's just a matter of showing them, hey, there's water in here, and this horse is just a baby, and it's the best baby. Yeah. So Boomer's in the vet barn because last Thursday he had a cut on his right side and it wasn't bad, and we just kind of put some ointment on it and he seemed to be doing fine. And then yesterday and today it's gotten worse, and we've tried to keep it clean and keep it good, but today it's just got to call in vet team and see what they can do here.
Let's do aerobic and anaerobic cultures. Do we know what he did this on?
No idea.
Hi, Bubs.
Wow.
So originally, she said it was a cut, but it looks like it's actually a puncture.
Oh yeah. We're, that's deep. All right, well, let's sedate him and let's clean it up.
I have pictures.
Cindy, would you mind grabbing the garbage can? This stuff is just really nasty, so.
I have pictures of the progression of it. Thursday. Really? Horses?
Groom horses?
Yeah.
Yeah.
Well,
Why do you not want to close a puncture wound?
Because it can't drain.
That's right. So, what do you do if you have an old puncture wound and you want to close it? What do you have to do to create drainage somewhere else? You
Create another hole?
You make another hole. That's exactly right. So, usually with these, even if it just happened and it doesn't smell infected yet, if it's a puncture wound, there's probably some nasty stuff that got out in there. And you can create another hole at the deepest part you can find, and then you can debride and close your original spot that's like ragged and nasty. So we'll see if I can find a pocket.
Okay.
Normally by the time we get them at Horse Plus, they're so far gone I can't do anything. But this one I think is fresh enough that, oh, this goes really deep, you guys. Okay, so I'm at the full depth that my finger can go and we keep going this way. What I would love is to ultrasound with a spay hook in place.
what is this giant thing?
That is probably the surface of the scapula. So bone is a nice smooth white line. So this is normal, muscle. That bright white is scapula, surface of the scapula. So what happens if you start here and just slowly run your way down? Ooh, yeah, look at all that. He's got a lot of muscle trauma in there too. So I'm gonna pull this. And I'm gonna make my lower drainage hole first. I know, buddy. I need a couple things. This is great. I feel good about this. Thank you so much. I feel done with the ultrasound for now.
Okay.
I need 50-50 lidocaine bupivacaine, 2 10cc syringes. So my plan is to create a hole down here to put some sterile drain material through, and then a hole a little bit higher up. So we're gonna have a piece of drain, which is just like rubbery material that comes out above and below this area, and then I'm gonna debride the dead tissue and close this. So I can't close it all the way because it's a puncture wound, but I'm gonna open additional drainage, and then we're gonna flush and flush and flush and flush the area. We're gonna send the culture off to see what kind of bacteria and also do a sensitivity, but in the meantime, we gotta start some antibiotics. We're gonna do a complete blood count to check and see where his white blood cell levels are today, and then we'll probably recheck that again on Thursday. And I'm obviously gonna numb him up where I'm gonna cut in a second.
Boomer. Sorry, bud.
Thank you on that. Okay, that one is good. And can you hold it open just a little bit for me? Yeah. So if you're watching this and you're taking notes and you're gonna try this by yourself on your own horse, the only reason why I feel comfortable flushing with this betadine way up in here is because I just did diagnostics and I know how deep this pouch is, and I know what plane of tissue it's on, and I have sterile gloves, and I have sterile saline to follow with it, so that when you come in to recheck it, you can like get a good hold and stretch it. I'm gonna scrub one more time I'm gonna put on clean gloves and then I'm gonna close and we'll be done. So Boomer has his drain placed, his wound is sutured up, he's waking up, he did great. I'm gonna put him on about 5 days of a pain and anti-inflammatory medication and also start him on some antibiotics. Our culture isn't back yet, so the test, the swab sample that we took to see what kind of bacteria and what antibiotics we can use, we won't have back for like another 5 days, so we don't wanna wait on the antibiotics. But I'm gonna check and see what his complete blood count shows before I pick an antibiotic, because that should give us an idea of how, oh, our neutrophils aren't even elevated yet. So this guy, the neutrophils, these are the first responders, little Pac-Men, and see how those are edging up. If we run this blood work again in like 2 more days, those are gonna probably be abnormal. So that tells me that this infection is really new, so that's great. Doesn't necessarily mean we can use less strong antibiotics, but it does mean I'm gonna give him an oral one instead of an injectable one.
Did I hear we're going on a road trip?
We're going on a road trip.
What's happening?
Barnyard Bash.
Barnyard Bash?
Barnyard Bash.
Dun,
Bye.
dun, 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 dun.
Do I want my Dr. Pepper?
Get that Dr. Pepper. Get it.
Hi guys, this is Liz from Plus Humane Society. I'm normally behind the camera instead of in front of it, but today I've been tasked with passing out flyers to the community. We have our Barnyard Bash on October 5th to kick off our adoption event. And we're trying to get the community involved, going to small businesses, big businesses, just trying to get as many people can to the shelter.
First up.
Tractor Supply.
Let's go.
We were actually just asking about if you had somewhere we could put flyers up for an event.
They got flyers they want to put up. They just go back on the board?
Yes, they go back there by the bathroom on our wall. Come on. You're like,
I mean, I'm sure we would find it eventually.
Better than nothing.
Better than nothing.
All right, Liz, where are we off to next?
We're just hopping on over to the Walmart next. Sorry, we were just wondering if you had an event board that we could put some flyers up on somewhere? No?
Okay.
Okay. Alrighty. Blast.
Yeah.
I said small businesses are probably where we're gonna have the most luck.
Probably is.
We love
Guess
small
we'll go to
businesses.
Main Street. Liz, where are we off to?
We are going to the elephant sanctuary. Is it a museum?
I think there is a museum and then obviously the sanctuary, which is not open to the public.
So this is more, yes, informational. We're just gonna go see if we can put up a flyer in there. I believe it's Nicole and Dr. Lydia have both been involved with the elephant sanctuary. We hear about it all the time, so might as well check it out while we're in there.
Hi there.
Hi. We're from Plus Humane Society, and we were just wondering if we could put one of our flyers with you guys.
What I can do with this is I can put this in our internal newsletter. We have a newsletter that goes out. We don't typically put things on our doors, but I'm more than welcome to share it.
Yeah.
internally.
No, we would really appreciate that.
We could do that.
Thank you so much.
Of course, thank you.
I think that the best places to pinpoint our restaurants.
I agree.
I don't know, we'll kind of play it by ear, because obviously some places won't make sense and some places will.
So we have Boomer in this morning. Dr. Lydia should be in momentarily. She was just checking on the status of another horse. Boomer punctured his shoulder last week, and by the time that staff was able to assess it and everything, he had a pretty good infection going on, it looked like. Lots of disgusting discharge. So we cleaned it up yesterday. Tuesday, Dr. Lydia had placed the drain, sutured it closed. Yesterday, it was pretty disgusting. It smells terrible. I know, it does. And we cleaned it up, reapplied all his topicals, and then today we're just kind of rechecking it again. We are waiting on the culture results to come back, but because of how disgusting it is and how much discharge is coming out, Dr. Lydia decided to put him on 2 antibiotics. So he's getting 2 different ones, one oral, one was an injectable. Just trying to get this cleared up because he's such a good boy and he should find a wonderful home.
Why don't I'll stretch this and you put that in and let's see if we can.
Oh, well.
That wasn't ideal. That's all right, just put it in that hole. Can you angle it down this way a little bit? Okay. I think I'm not thrilled with the level of drainage we have. Okay, let's try to flush again and let's see what comes out.
Do you want to just cut these 2 out since they're not doing anything?
Let me cut the top one.
Because this
it came completely out.
Well, as I was flushing, it was already like falling out, so there was
drain failure.
Swelling wise, yes. The discharge was still really good.
You're being a really good boy, Boomer. The muscle fasciculations to me is more of a pain response.
Yeah.
It's a fear response, but it's also a pain response. I just want to grab my stethoscope and get a heart rate on him real quick, and then we can kick him out.
Okay.
His heart rate's 40. We just finished a little recheck on Boomer. Boomer is a thoroughbred in his mid-teens. He was an owner surrender. He's the sweetest boy. So we had just turned Boomer out into a bigger pasture, and we don't know how he hurt himself, but he punctured himself on his right shoulder, and I first saw it on Tuesday, a few days after the injury happened. Whatever is in there is not great. The discharge coming from that wound smells really disgusting. So on Tuesday, we collected a sample so we can know what bacteria is present and which antibiotics we can use, but we don't have those results back yet. Boomer is the perfect patient. We were able to flush it and clean it today and do some cold hosing therapy without having to sedate him. We just gave him a lot of cookies. So he's doing really well, he's stable. I'm just hoping that we don't have some super bug. So yep, that's where we are with Boomer. I'm very hopeful for him. We don't have any reason to believe that he has a broken bone in there or that he has any foreign material. Those would be 2 things that would make our concern much worse. And we know exactly when he got hurt. He does look better, but he still has a good amount of discharge from the area. The drain that I placed on Tuesday wasn't big enough. I really want a big open hole. So I actually removed 2 of the 7 sutures that I put in on Tuesday because that was the original drainage tract and that's where the body wants that discharge to go. And we don't ever want to hold it in. That's when we get an abscess. So hopefully we'll get those culture results back soon. We usually get horses that are like, wow, that happened months ago and now we're trying to fix it. So those things are definitely working in his favor and we'll keep you guys posted.
First stop, Snappy's Pizza.
You can post it on that door out there.
Okay.
Just as long as the hours aren't blocked.
Perfect. All right. Thank you. Thank you.
Awesome. Thank you so much.
Hello. We were just wondering if we could put up a flyer for a community event that we have going on.
What is it?
It's the Barnyard Bash, so we're from Horse Plus Humane Society.
Okay.
We're having a community event just to invite people to the shelter and they can learn stuff about us and then have a bunch of fun activities.
I'll put it in the window for you.
Thank you so much.
You're welcome.
You wanna try it?
Yes.
Hello.
Hi. It's all good. We were just wondering if we could put up a flyer. All right. Hi, we just have flyers that we're passing around for a community event at Horse Plus Humane Society. Okay. We're wondering if we could post it up somewhere.
Did you need tape?
I did bring tape.
Okay.
You're jamming?
Mm-hmm.
How are we doing so far, Liz?
We're doing pretty good. Most of these places already have like event boards, which is super nice. And helps us a lot knowing what places are a little more open to it.
Mm-hmm.
I don't know. I feel like we're just getting started.
Yep.
And it's going great.
I think that clipboard's really
Makes me
helping
look
you.
official.
Very official.
I thought it was the way I carried myself. Hi.
Okay, I need to get a hold of y'all. I got I just called some acres.
Okay.
Looking for a couple Greenbrook horses. Not really, because we do all the training.
We got plenty. Yes. But I'm sure if you wanted, like, if you couldn't make that work, you could just call us and like schedule to come in, just so that we know that you're coming. But yeah, we take all the help that we can get.
Thank you.
Thank you.
What's your name?
I'm Liz.
I'm Eddie.
Good to meet you.
Good to meet you.
Liz, so what just happened?
Oh my gosh, that was the coolest thing ever. So we just went to a restaurant across town to see if we could put some flyers up, and we were probably standing there for, I mean, it felt like forever, but it was maybe like 5-10 minutes. We couldn't find anybody, and then we walked into the bar because we heard some commotion over there. And the bartender came up and I asked her if we could put the flyers up, and she asked, oh, well, you guys are just like right over there, right? And I was like, yeah. And she said that she's been meaning to get into contact with us, and she's looking to adopt 2 horses soon.
No way.
It was, adoption event. So I gave her the flyers, invited her to check us out, look at the horses, and to schedule an appointment with us to check out the horses that she's interested in. So maybe we'll be seeing her this adoption event.
Hi, guys.
They're still terriers.
Yeah.
Or kids, like people, oh, look at Admiral.
This is actually helpful. I don't mind watching them walk some. Don't step on Sydney. Is she actually his mom? Okay. I mean, I can do an exam on the move a little bit. We don't need a lot done.
We got a lot of pokes though, so hopefully
we do have a lot of pokes.
Good for that. Very tall and handsome.
Easy, sir.
Where did I stick this to?
No, sir.
That is very rude. You're about to get poked.
Good boy.
Good job, sir. Does he need a microchip?
Yeah.
Okay.
We got blood. You're vaccinating. Microchip. We don't need to deworm. Okay.
Vaccines are on board. He does appear to be a gelding. Do you pick your feet up? Can I see your foot? What do you think about this? Good boy. Good boy. Okay, let me put it down. Easy. Good boy. Okay.
Now that we've done got him trained. They dragged me from there to like I'm there. I was just going with him because you know I can't do anything as big as he is. 100.3.
Thank you. That's normal. Hi, I got nothing for you. You're a good boy. Don't smack your lips around, though.
He's so pretty.
My girls put googly eyes in their horses' noses and do like little videos with their nostrils as people.
How is that like a...
So if you look, the fulcrum point for that gate is right where the saddle goes.
Yeah.
So it looks really discombobulated, but actually when you're on those horses, they are very smooth.
Huh.
They are. We can't catch them, but...
Sydney, we should try to remember, based on what I've seen, I think this guy's gonna be very adoptable. People are gonna wanna know how tall he is, and we didn't collect his height. All right, he comes up to basically the bottom of my nose.
Okay.
It's not real specific. Sir, can you give Sydney some space, please? Go on.
Come on, we're gonna go this way, bud.
Hi, Mama.
He's like, no, we gotta...
All right, I got you. Hi, no bites.
He did bite Mom. See right here?
Oh, yeah.
I mean,
I think somebody sutured this up.
Those two
I think they were
that's from where he just latched on.
Listen, you leave your mama alone, okay? She has a lot going on right now.
Yes.
Good girl. The only thing she was reactive to was when my stethoscope swung around and it looked like a rope. We just finished doing intake exams on some owner surrenders. Their names are Willie and Lady. They're very sweet. We think that she is his mom and he acts like a naughty baby boy. So it's kind of funny. And she's very tolerant, but they're both Tennessee walking horses. In my opinion, they both look younger than their reported age, which is not what we usually get. We pulled blood on them. They got some vaccines. Neither one of them needed to be dewormed. I have no major health concerns. We're putting them both on our farrier list. And then once their Coggins test results are back in and their quarantine period is over, they'll have a training evaluation. But they were very sweet and up in our space, which I like. Sydney got nibbled a little bit, not with malicious intent. These guys both are clearly normally gaited Tennessee walking horses. They're very beautiful to watch. They look very smooth. Hi, Willie, are you a good boy? Yeah. So yes, the big leg gait clearly is not a normal gait for these horses to have. These are both beautiful, reportedly purebred Tennessee walking horses, although, you know, we don't have their papers. So, but based on how they look and their physical exams, that seems very accurate. I'm always so thankful when people who could just go sell a horse want to take them somewhere where they can have a full workup and then can find a great home. So it's awesome for us. If you watch Horse Plus, we get a lot of animals that are very, very sick or very, very injured. And so we have more sad endings than happy endings. So we're always happy for the happy endings.